Absolutely. I'm biased, so I'll give you a little background. I did one semester of engineering school, but I've been a tinkerer my whole life. And what I've learned by having a startup company built around a medical device, looking at artificial intelligence, is there is a tremendous language barrier between most technicians, lay people, and physicians. Then when you add in those who've studied business, you're really trying to get people who speak four different languages to have a similar goal. Um, and I always say it's up to the well-educated to be more educated. And so for those who are at the top of their career, see, I think healthcare will really benefit when we monetize it in the sense, putting somebody in a cardiology office or putting somebody in a pulmonary office whose background covers both realms. Not saying it has to be professional background, but who has an interest in it can really help translate why this particular device or software is useful. And then once the data comes, making sure that that is actionable from a clinical standpoint. The last thing you want is something else you're being forced to do that really has no clinical benefit, right? That's a waste of everyone's time and money and resources. But I think ultimately that would be the goal. I think, starting with medical education, for those who are interested in it, having, courses that start with, introduction to healthcare. So, if you're in a medical device world, what I want to see is engineers and technicians and software developers and business people who have to take a 6 to 8 week course in basic medical care. Then if they're looking at a particular field, another refresher course or certification. I think it helps to understand because what we do is not just data. The data is so crucial. It is crucial, 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 but so much of it is human interaction. And I think the data, it has the potential to be very cold and calculating and hence push people away from healthcare at the same time or be manipulated. And so understanding, how that kind of user experience goes, not only with just a physician, but with the product, whether it's a software or a service or a device, is also crucial. It's hard. Physicians were busy. It's hard for business people. They're busy. It's hard for developers. They're busy. But I think having these collaborative teams, both at government levels, regional levels, university levels, but even within hospital systems, is an absolute must. One of the things I've been working on doing is getting a rapid improvement exercise to say, when I have a physician who wants more information, how do we sit between that physician's desires and the team designed to build it and really come up with a product that not only that they can use, but that can be replicated. Because if it can't be replicated, to me, it's probably not really a good system. It may not even be providing accurate information.